All right, let's talk about the COVID vaccine because changes in vaccine policy are raising questions and causing a lot of confusion. We heard from a lot of you who have tried to make appointments to get the vaccine and are hitting walls. Here's a voicemail we got yesterday.
I'm 79 years old. I just find it appalling that our public health agencies apparently are not encouraging doctors to give a prescription to elderly people like me.
Now, we've heard from others who've had their appointments for the shot canceled or rescheduled suddenly. So what's going on? The problem has to do with several federal and state agencies. In August, the federal government announced the updated COVID-19 vaccines are now approved for people 65 and older, as well as kids and adults with at least one pre-existing condition that puts them at risk for severe illness. Previous versions of the vaccines had been recommended for nearly everyone, regardless of health status. But this year, that changed. Back in June, Health and Human Services Secretary Robert F. Kennedy Jr. fired the entire Vaccine Advisory Committee for the Centers for Disease Control, called the Advisory Committee for Immunization Practices. He replaced them with fellow anti-vaxxers and people who have questioned the COVID vaccine. So although the FDA cleared the vaccine, the ACIP, that committee, has not yet issued its recommendation. They're expected to do that later this month. Now, let's get into state agencies. State policy forbids pharmacists from giving out the vaccine to anyone without a prescription until ACIP issues its recommendation. In recent years, the committee met earlier in the summer so that shots were available ahead of the winter respiratory season. Now they're not scheduled to meet until September 18th and 19th, when they may issue a new protocol. The Oregon Board of Pharmacy said this delay is causing confusion and disruption in access to this important vaccine. No protocol currently exists for the 2025-26 formulation. This means that in addition to narrower eligibility criteria imposed by the FDA, Oregonians may experience additional barriers to accessing COVID-19 vaccines at a pharmacy without a prescription until a protocol is adopted by the federal government. In response to this evolving situation, some pharmacies are now making changes to scheduled appointments. The board says once a protocol is available and adopted by the state, then pharmacists will likely be able to give out the vaccine, at least to some people. We recently heard from a local pharmacist on how he believes getting a vaccine will work at the pharmacy going forward.
Basically, we will have to ask them, are you at risk of complications from COVID? So if you are, then we will probably need some documentations in order to get you vaccinated. Most likely, insurance will probably require that as well. If the insurance doesn't cover it because patient's not eligible for it, then I would have to say, I do have to make sure the patient is eligible to get the vaccine. I cannot just override that. So in that case, it'll be really hard for patients to get the vaccine if they're not eligible for it, even if they're willing to pay out of pocket for it.
Now, by law, most health insurance plans are required to fully cover vaccines recommended by the CDC and the ACIP. But if you fall outside of the group they recommend for it, you may have a copay or even have to pay the full price of the vaccine. It all depends on your insurance. The CDC has the price for the vaccine listed at around $140. Now, those delays are in part why Oregon and Washington are joining California and Hawaii to form the West Coast Health Alliance. The goal of the partnership is to create and announce its own vaccine guidance, separate from the CDC. Here's what the Multnomah County Health Officer has to say on this new alliance.
And I think what we're trying to do is get the band back together, so to speak, so that we can start to have local recommendations using trusted sources such as the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, the Infectious Disease Specialists of America, these trusted physicians who are vaccine experts to make recommendations about who should get certain vaccines when we're talking about COVID, flu, and RSV vaccines this respiratory season.
Now, how they plan to do that is still being worked out. The director of the Oregon Health Authority said they're working as quickly as possible so they can ensure people don't pay out of pocket to get the shot. The Washington Department of Health signed a standing order into effect last week, allowing anyone in the state 6 months or older to receive the vaccine without a prescription.